Welcome to the Laser Therapy Institute weekly podcast, the world's first podcast about medical laser therapy for healthcare providers. Each week, we discuss the latest research, interviews with experts, and how laser therapy can enhance your practice. Now, here is the founder of LTI and your host, Dr. Jason Rountree.
All right, thanks for joining us today for the Laser Therapy Institute weekly podcast. I'm your host, Dr. Jason Rountree, and today we have a special guest, Dr. Agnieszka Kluchy. She's from Galena, Illinois. She's been working with laser for a number of years now, and today we're going to be focusing on acute injuries, using laser to treat acute injuries. So, Dr. Kluchy, welcome.
Hello, thank you so much for having me.
Absolutely, pleasure to have you here. So why don't you tell us just a little bit about kind of your background? Now I know you're a chiropractor, but walk us through kind of how your career has been going and where you're at now.
So I started practicing 10 years ago, and my primary focus has always been in the realm of non-surgical orthopedics. So I focused a little bit on every muscle, bone, joint in the body for everybody in the whole family. So not just athletes or not just geriatrics or pediatrics, but the whole family. And I've also always been integrated well into the medical community for purpose of referrals, whether it's imaging, potential injections, or even surgical interventions when medically necessary, or just for a consultation. So that's kind of where my practice has been currently. And I practice a little bit with class 3 lasers in the past, but not class 4 until most recently, last 2 years.
Okay. So how did you kind of get started into the class 4 laser arena?
Well, I had a lot of patients that I was not able to improve at 100%, right? There was always a plateau they had reached, or whether it's range of motion or pain or levels of activity. And that started the search from going to doing just class 3 laser and ultrasound and gua sha, Graston, those types of techniques. The class 4 laser allowed me really to promote additional healing and further depth of healing into tissues that in most instances without laser therapy would be irreparable and continue on to chronic conditions.
So you're not just talking about pain relief, like short-term pain relief with laser. You're talking about actually healing.
That is correct. On a cellular level, yes.
Excellent. So you use laser right now in your clinic, class 4 laser in the clinic right now. What else do you do for a lot of your patients?
Including class 4 therapy. We do some rehab stretches, exercises. We do kinesiotaping and obviously chiropractic adjustments as well. So the class 4 laser incorporates very well. Because I have a class 4 laser, I don't have a need to do any electrical stimulation or Russian stimulation or ultrasound or any other type of modalities. My class 4 laser is pretty much all that I need.
Wow, that's awesome. Well, let's talk about, we're here to talk about acute injury care with laser therapy in particular, and we're going to be focusing on class 4 laser a bit, but I've got a background a little bit with class 3 also, so we can talk a little bit about class 3 versus class 4 laser. Class 4 lasers, of course, are those that are putting out more than 0.5 watts of therapeutic laser energy, and then your class 3 lasers are below that half a watt there. So we're not talking about surgical lasers, obviously. We're talking about a therapeutic dose that is above, a half a watt. And our machines they'll go anywhere from a half watt all the way up to 20 to 30 watts. I think yours tops out at 28 watts. Is that correct?
28, correct.
Yeah. So you can put a lot of laser into an area pretty quickly. And let's talk about what we mean really when we start talking acute injury. When you say an acute injury, what are you thinking of?
An acute injury is a sudden onset of whether it's pain or a sudden onset due to a traumatic event, such as a car accident, a slip or fall on the ice, or even a volleyball player lands wrong after spiking a ball in and sprains his or her ankle. So those are immediate type of injuries that fall into the category of acute injuries.
Okay, yeah. So your sprain strains, your hematomas. Um, uh, what about so we're not talking kind of chronic cases. We're not talking about that car accident that happened 2 years ago that still has ongoing symptoms. We're talking more recent, right?
That is correct. Yep.
Okay.
More recent.
So, those are those more recent injuries. A lot of times we'll talk about limited options for treatment because there's just not a lot out there to really be able to offer these patients. So when we're talking about kind of your more traditional options outside of laser therapy for these acute injuries, what have you seen to be effective? What are the options out there outside of laser?
Outside of laser, aside from some ice and maybe some anti-inflammatories, not very much that reproduces the type of end result that both the patient and the clinician is looking for. Okay.
Yeah. So when you start thinking about acute injuries and what you do every day now for those acute injuries, is laser a pretty big part of your care plan?
Most definitely. That is the first go-to in my toolbox is the laser. Some patients will even come in with a lumbar sprain strain and will say, doc, I think I just need an adjustment. This will get me right back and go in. That's where patient education comes in as well. As if you're barely moving, I'm barely going to get things to start moving. So we need to start on the cellular level and promote healing within those critical tissues.
Have you seen it be easier actually to adjust patients, if you can use laser along with that treatment session?
Oh, most definitely, because they have, for the most part, in most instances in acute injuries, they have instant relief, pain relief, and also a significant amount of inflammation reduction, just even after the first visit.
Wow, that's awesome. So you can get them moving a lot quicker, get them back to being more functional without having to really put them through the ringer, so to speak, as far as adjusting and other therapies.
Oh, most definitely.
Awesome.
Huge difference.
That's great. So, I know those hot low backs that come in, those really tender patients that you're real limited on options. A lot of times if you're stuck with just what you can do with your hands as far as manual adjusting and other soft tissue mechanisms, those are a lot of times very, very slow to progress and can turn from an acute injury into more of a chronic condition. What have you seen using laser in those acute conditions? Are you seeing any difference as far as getting patients through recovery so they don't progress to a chronic stage? Is that something you've been able to see as well?
Most definitely. I would say roughly about 80% of patients who come in within the first couple of days to even sometimes the first week with an acute injury, after that first visit, they notice a significant reduction of pain and a significant increase just in range of motion, and also a reduction, if not complete elimination, of any type of pain medication that they were already taking. So they're already able to get back to work, able to function, take care of their families, do these types of things. And so once we're able to get them in that state that quickly, then we're able to do more stretching, more exercises to strengthen them quicker and rebuild that muscle, opposed to having them fight through an acute injury that really shouldn't go beyond a week, max two. Most people are going straight from that acute phase right into that chronic injury and never really truly healing from it.
Wow. Yeah. Wow. That's worth quite a bit to be able to return to work sooner, for one thing, but then just being able to go back to that family life, you save a few days, in recovery. Being able to recover faster should mean that these patients are doing, their normal activities that much quicker. That's worth a lot.
Most definitely. And the patients state that as well.
That's awesome. Excellent. So, what are we talking about with, say, some of the real common stuff, like an acute sprain strain of the ankle? Somebody rolls their ankle. Are we talking about, how many treatments will you typically do for these acute cases? Is there a lot of variety? How often do you need to see a patient? What's your kind of protocol like?
if somebody's coming in with an acute case, I like to see them, if possible, 4 times the first week if I can. Obviously, if they're coming in on a Wednesday, I'm limited to when I can see them. But if I could do the first 4 to 6 treatments, once again, depending on the severity, the closer, the better. In some instances, a patient has to come in the AM and then again in the PM, but that's in the most severe instance. If it's just your general ankle sprain strain, grade 2 sprain strain, I'll see them for a couple of days. But I would say a very high percentage of those patients, by the second day that I see them, notice a significant pain reduction, inflammation reduction, as well as just being able to have more range of motion immediately. So beyond an initial 4 to 6 treatments, beyond that, patients really are able to get right into rehab very, very quickly.
Well, that's huge. If you look at the data for something like shoulder injury, shoulder sprain strains, the incidence of adhesive capsulitis, frozen shoulder happening, from the patient not being able to move the arm or not being able to do their activities, that's a big deal. That a lot of times can lead to, permanent disability or surgical intervention that's needed for something that should have been resolved quickly. So you're talking about really saving patients from sometimes months and months of disability, of surgery and ongoing medication, things like that, just by jumping on this quickly.
Most definitely.
Wow. Awesome. So when a patient does come into you and they've got that injury, how do you go about talking to them about, getting laser involved? What do you like to tell patients?
I always educate the patient on their condition and exactly what is going on and what the tissue underneath looks like. Most people just feel, okay, I have pain, just get rid of my pain. They're not understanding the amount of damage in the underlying tissue or the chemical reaction in the inflammatory process that's actually occurring. So really educating patients on what they have, what's going on, and what this would look like without any kind of treatment, and what their options would be with no treatment, and then what their treatment options are. However, most of my patients are very well educated, and so they're already educating their loved ones when they come in. And so they know, okay, I rolled my ankle, I need a call, I need laser immediately. And so there's really no question, because they see, 4 or 5 family members, coworkers that have come in and reaped many benefits from laser therapy.
Yeah, so they already know what they need to have done. That's great.
Yes, definitely.
Awesome. So you're a member of Laser Therapy Institute. You're one of our member clinics. Do you want to talk about that at all? Do you want to talk about some of the things that you've been able to develop with your clinic or benefit from with your LTI membership?
Most definitely. I have, prior to becoming a member of LTI, I had the class 4 laser, and so I was able to, generally, when you have an understanding of conditions and how you need to treat them, and you just use another modality like a laser, you could pretty much figure out how to use a laser in most instances, right? However, since starting LTI, I've really had a greater understanding of what the laser can actually do and on what significant level, right? And how to process each patient's condition differently, and how to get them through a different series of treatments, but also explaining the importance of it, opposed to, okay, let's just do one treatment at a time. And it goes hand in hand with, if it is something like cervical, lumbar, getting them on laser treatments along with adjustments and stretches and exercises. It just really goes hand in hand. Excellent. In the whole treatment process.
So LTI clinics do get access to several dozen different, custom developed treatments. Have you been able to use those? And if you have, kind of a 2-part question for you. If you haven't been able to use those treatments, how critical are they, do you think, to doing laser therapy? Why aren't the default programs that come with your laser, why aren't those enough?
I would say they're not enough in the sense that majority of them start off with oversaturation of the tissue with too much power, right? And not enough time, too much power. It's not as much of a localized treatment. With the programs from LTI, I've definitely noticed a difference with the patients that I've used only the presets to, because I was using a small variety, so I wasn't saturating the tissue with a wide variety of the potential of what the laser can do. Whereas with LTI, I'm able to saturate the tissue in different levels, different depths, with different with different amount of strength to allow for different types of tissue healing, but also on a systemic level. So for example, when I have patients who have post-surgical pain, I never even really thought of treating somebody post-surgically and the effects I can have just using the regular presets from the laser. But learning these programs through LTI has even taught me the most complicated issues of post-surgical care, for example, or patients who even have post C-section pain and limitations, allow tissue healing on a greater level where there's no preset for C-section pain, right? And then also for patients who have different type of inflammatory conditions, who have a lot of inflammation in their body, or patients who have different types of hormonal imbalances or struggle with anxiety, or even patients who have different types of addictive behaviors to smoking and such. All these programs are not presets on the laser. Everything that I have been able to learn with the LTI program has definitely added a huge additional dimension to my practice and the patients I'm able to treat.
Well, great. It's great to have you as a member of LTI, and I really appreciate you taking the time to talk to us today, and I'm sure we'll be talking again soon.
Yes, thank you very much.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.